And hey everyone, it's Evan Kirstel. I'm with a couple of my favorite people on Twitter today. First and foremost, Tom Lawry, National Director for AI, Health, Life Sciences, and more at Microsoft, a little trillion-dollar company you may have heard of. And of course, my partner at Avira Health, Irma Rastagaiva. We'll start with you, Tom. Say hello to the audience.
Hey everyone,
We are
great to be
live.
with you. Shout out Evan, Irma. You are two of my favorite people. Anytime I go to Twitter, I'm always entertained by going out and looking at what you all are posting. So, it's great to be with you today. And I'm always amazed at where you come up with some of the amazing stuff you post. It's like, how do you do it? But anyway, great to be with you.
Well, mostly it's taking content from your books. So that's what we're here to talk about today, your books, your perspective, your current experience as part of the pandemic, and beyond. So let's dive right in. And Irma and I have lots of questions and would love your insights and analysis. But let's take a little flashback to November of last year, which feels like an eternity, actually just a couple of months ago. You shared quite an optimistic article around the pandemic. We interrupt the pandemic to bring you some good news. An article in Forbes. How are you feeling now? Are you feeling optimistic? What's your personal perspective? Does it depend on the day or the week? Give us some insight.
Well, I think with everyone and anyone who's tuned into this, I'm sure you can relate with Omicron and the exponential growth curve we've seen. It's like I know I've curtailed a lot of my activities just to try and have a lower profile, so that doesn't feel so good. But relative to the piece I did for Forbes in November, I'm actually going to take one more jump, and then I'll come back to it. So, what's interesting to me is we're live streaming today, which it was 2 years ago today, the CDC reported the first death in America due to the coronavirus and COVID. So think about that. So it's almost like when I saw that the other day, I thought, how differently we think and act today. Where imagine it was just 2 years ago where the very first death was reported to CDC. Now fast forward to kind of what we're used to today. It just, to me, it's almost like you measure time in BC before COVID and AC after COVID. So we've all had this shared experience. We've all tried to figure out what's going on, and if you're a care provider, it's like you're on the front lines of how to care for people. If you're a consumer, it brought a lot of things into focus as far as the way you live your life and your priorities. But anyway, when we roll all that up, the article I wrote was to really say, look, we're still in the thick of this. We're still trying to figure it out, but let's pull back and look at what we have learned, this good news. So what we've learned are things like healthcare has always been known for moving at glacial speed. And we saw that healthcare can go from glacial speed to warp speed when it needs to solve a big problem. I would do a shout out to say many of the clinical and health leaders, they did quick pivots. They figured things out on the fly. And I think we need to, one, look at that and give them credit. Two, my challenge, as I point out in the article, is if we can do that fast pivot for solving a big problem like the pandemic, we ought to be able to take the same learnings to say, how do we do the same for all the other big challenges, such as the opioid crisis, chronic disease, the way we treat patients when it comes to not the clinical ways we treat them, but the way we treat them when they're sick and vulnerable, and we run them through this myriad of things that are not very consumer friendly. All of those are big problems. If we can solve fast for the COVID crisis, we ought to be able to go faster on all those other things. The other point that I made is, it's humans that really were fighting the war, but what made them go faster was the increasing adoption and use of artificial intelligence. And so you look at things like, historically, it would take an average of 12 years to bring a vaccine to market. We brought vaccines to market in a little over a year. We had things like millions of people who were very nervous about not knowing what to do. So, we saw things like the use of chatbots that allow people to go out, plug in their situation and get exact information on what they should be doing based on clinical guidelines. So we've learned that healthcare can move quickly. We've learned that AI works and helps move the needle faster. And my whole premise is, the pandemic will move to become an endemic disease like chickenpox. As that happens, let's take what we've learned and apply it to solve the other problems, only go faster.
Yeah, I love the idea of creating value with AI today. AI has moved out of the research labs of Microsoft and of many other companies and into the real world. What are some examples of practical applications of AI in healthcare that have you excited for the future after it's been quite a promise for quite so long?
Yeah, well, as you know, AI is one thing and many things. So, I mean, we could spend multiple sessions just answering that question, Evan. But, top of mind, a lot of just in the last 2 years with COVID, AI has been used obviously to start doing everything from really upgrading telehealth. Let's stay there for a second. Before the pandemic, only about 5% of health organizations were actually doing telehealth. And in the first 6 months of the COVID pandemic, we saw a 38-fold increase in telemedicine and telehealth. And some of that's dropping off now, but nevertheless, it's here to stay. Another good part of the pandemic, I guess, is telehealth has been around for 3 decades. And yet many people just got their first taste and first use of it in the last 2 years. Pandemic was a forcing function for telehealth. And, the challenge I often put out, particularly for those in the health industry, is particularly in America, I think the provider world has what I call an edifice complex, where somehow we've been conditioned to believe that real healthcare involves getting in your car, driving to a bricks and mortar location, sitting in a waiting room, reading outdated old magazines, only
Filling
to
out
go.
a clipboard,
Yeah,
don't forget the clipboard that you fill out with a pencil.
yeah. Although I forgot the clipboard, even though you filled that out the last time you were there. But you go through all of that, and then you look into the eyes of a provider. Well, if you're lucky, you look into the eyes of your provider. That's what we've been taught. Telehealth, virtual visits, it's dramatically improving that experience. And for some cases, not all, it's as effective. And some of the data is showing it's even more effective than going through the old-fashioned way of doing things. So I'll go one more level, and then I'll stop. I don't want to go on a rant, but so just what you said. So let's look at that traditional thing. Any of you that have a primary care doctor, think about the last time you went to see your physician. So again, you drive your car, you find a place to park, you sit there. Eventually, when you're in that little cubicle and the doctor walks in, at least in my experience, and I got a great primary care doctor, the only time I really have him look in my eyes is when he's walking in saying, "Hi, Tom." Once he says hi, what does he or your primary care doctor typically do? They'll go to the corner of the room, they'll sign on to the EHR, they'll ask you questions as they stare into the computer screen and hunt and peck to look at things.
With your back, they're back facing you. That's
yeah. So one of the things that we're excited about is we're in hopefully the final phases of regulatory approval. But Microsoft is acquiring a company called Nuance, which is the leader in conversational AI for health and medicine. So they basically have a solution where it's getting to the point where clinicians can be restored to actually having that conversation with you. So basically, it's using ambient AI and ambient intelligence. So they can have that conversation with you. As that's happening, they're using everything from voice recognition, natural language processing, and a host of other things going on in the background that are capturing those conversations, converting them into clinical notes, starting to do all those things that a physician has to manually do either during or after that visit. So they can actually, instead of being a data entry clerk, actually act like a physician. There's a great study that showed the average primary care doctor, the average visit with a primary care physician, the physician will spend more time during and after the visit in the EHR than they will actually spend time with you as the patient.
Wow.
So imagine the doctor's more tuned into their patients. It's reducing that repetitive activity. that makes them feel more like a doctor, less like a data entry clerk. And all of that's happening in the background through the use of AI. So those are the kind of things we're excited about. Telehealth, I know the American Telemedicine Association has done a phenomenal job of championing telehealth for years. They're really pushing hard on everything from reimbursement parity to the continued infusion of artificial intelligence to take telehealth and make it even better and more efficient. So those are just some of the things. I could go on, but I won't.
Actually, I'd like you to go on, and specifically, so you gave us an example of using AI and related technology to help with a problem that COVID really exacerbated, which is physician burnout. I would like you to tell our audience another example of how Microsoft and technology has come to play an important role early in COVID, specifically in the information gathering phase. You write in your article back in November about how we had a lot of knowledge about coronaviruses, but it wasn't really in one place in a very accessible way. So could you tell us more about how technology helped put that all together?
Sure. Yeah. So again, everyone, if you can just fast forward, do you remember when this thing first started hitting? No one knew what it was about. No one knew what was going on. And we finally woke up to the fact that this was a global pandemic, and everyone started mobilizing. Everyone, our providers, drug makers, public health officials. I mean, everyone was scrambling at the same time. So early on in the first phase of the pandemic, everyone woke up to the fact that there were thousands of articles on the family of coronaviruses, but they were scattered around the world. So articles, research studies, white papers, but they're scattered around the world, different formats. So there was a group, and it was run by a number of people, but particularly the Allen Institute for AI here in Seattle, CDC, Microsoft was part of it. But essentially, we came together to say, what do we do? And essentially, what ended up happening is we brought together several tools, including one from Microsoft on natural language processing, and essentially used AI to fuse together 47,000 articles and research studies literally in a matter of days, where now we've gone from information scattered around the world to a central database and system that was fully searchable. And we made that available for free to any researchers, any public health officials. So we literally, in a matter of days, were able to mobilize to allow drug makers to get a head start on their research, public health people to start really looking at the body of knowledge that had been collected over the years and start applying that, where you can only imagine if every one of them were out there doing the free-range chicken thing to try and find research, bring it in, assimilate it. So, it's a group of technology companies along with groups like CDC that use the technology to give everyone a head start on research and knowledge.
One of the themes you talk about is AI versus natural human intelligence, and how AI is about augmenting or enhancing human intelligence. Maybe dive into that a bit deeper. It's an interesting theme that you don't hear much about.
Well, yeah, it's a great point. I think everyone's getting a little smarter on what AI is and what it isn't, but it's always interesting to me because in the application of AI in health and medicine, there are still people who think or portray AI as eventually taking over medicine. And, you often see articles or you see these images of robots doing healthcare. And I, for one, like when I need care, I really don't think I want to leave my care to a robot. But anytime I see that, or in my role as a strategic advisor for AI and a speaker and an author, I often come across people who are kind of debating the merits or the value of using AI in health and medicine, and they talk as if it could be stopped. And anytime I hear those conversations, it kind of makes me think of, I wonder in the very early days of our ancestors, what they were thinking when they had the debate about whether fire was good. It's kind of like AI is here, it's moving forward. We get to decide how to use it for good, how to put guardrails around it to keep it from running amok. But back to the question. So, humans are so smart, we've actually figured out how to outsource things that only our brain heretofore have been able to do. So, we now have AI at human parity, meaning it's as good as a human in things like vision, speech, knowledge recognition, so many other things. And those are the things being applied to make healthcare better. But in doing that, AI is always going to be done in ways that augment the unique characteristics of humans. So when I think about all the things I just said, so knowledge extraction, I can use AI to search through massive amounts of data that no human could ever sort through to find patterns and trends on things like maybe clues that lead to a better diagnosis or treatment decision for a cancer patient. So it's really good at that. But it's really good at certain things like it's essentially correlating variables. And without geeking out, I mean, one of the biggest things to answer this question is when it comes to the practice of medicine and healthcare is we use those things AI is good at, but there are certain things AI is not good at, nor will it ever be. So when I look at the practice of care, that involves things AI is not good at, nor will it be. Things like judgment, wisdom, common sense. And we often get into this debate of correlation versus causation. So AI is good at correlation, but causation is something that's uniquely human in what we do. So I'll give you a quick example of this in my new book where I'm not a data scientist, but I'll play one for this exercise. So I brought data together. I used some really great AI tools and machine learning, and I came up with a discovery that I don't think has had much visibility, but hopefully my book will give it. And what I've learned is there's almost a perfect correlation in America today between per capita cheese consumption and the number of people who die by becoming tangled in their bed sheets. Perfect correlation. So think
How
about
did you know I love cheese? And
Evan, if
it's a bit
tonight
concerning,
I
actually.
get you to step away from that cheese plate, you may be able to save a life. I'll stop being facetious now, but it makes the point of AI is so good at things, but it has to be put in the hands of and in the service of the humans who are driving healthcare today and will be driving healthcare tomorrow. And once you understand that balance, that, if you're a clinician, if you're a healthcare executive, to me, that becomes your superpower, saying, here's how I use AI to make what I care about better. Here's what I use AI for to better leverage that in service of making those clinicians able to practice to the top of their license, doing things like reducing the repetitive tasks, which often are a great predictor of burnout. So it's bringing that into balance, understanding that really creates the value proposition for how you're going to drive value at scale using AI.
Really, really interesting stuff. Let's shift gears a little bit and talk about a topic that's near and dear to my heart as someone who's feels like I'm aging far more quickly than I should be. You said that intelligent aging is healthcare's moonshot. I'm looking at myself on camera. I feel 10 years older than I was 2 years ago. Maybe Irma's the only one not aging on this call. But what did you mean by intelligent aging? I haven't heard that term of art before.
Well, again, that I could talk a long time on that, but I'll try not to. So first of all, put technology aside. Let's just think about this for a second. So in America today, someone turns 65 every 15 seconds and will for at least the next 10 years. So when you look at the boomers, they've always been a force, starting from the time they were young to today. And the very group that coined the phrase "Hell no, we won't go." When you look at boomers going into those advanced ages, they're not going to go quietly. They're not going to act the way their parents did. Number one. Number two, when you look at the amount of money we spend per Medicare recipient on basically a reactive health system, where it's a break-fix model. Medicare guarantees certain services once you are ill, once you need something solved by surgery, by treatment. All of that's important and needed, but it's one, not sustainable, And two, it really doesn't get us to, ask anyone in healthcare what their mission is. And I almost will guarantee somewhere in that will be the answer of health and well-being. So we can kind of solve for some of the health things, but when it comes to well-being and seniors, we have a huge problem. Starting with economically, it's not sustainable. If you look at the ratio of workers who are taxed compared to the growing number of people who are receiving benefits, that alone is not going to work. It's going to totally break down in the next 10 years economically. But beyond that, we've got things like quality of life, and not just doing a medical condition, but improving not only the lifespan, but with one of my favorite gerontologists, Ken Dykewald, talks about health span. So, increasingly, you put aside what's been happening the last 2 years with average length of life because of COVID and some other things. The trend line is going to keep moving up, where once you get to be 65, your probabilities of living to be older than your parents go way up. And the question is, even though we're growing, the number of elderly into advanced ages, that's lifespan. But if I were to say to you, Evan, what if you could live to be 100? Would you like that? Most often the answer is going to be, well, it depends. It depends on if I told you I can have you live to 100, but the last 6 years are going to be very compromised, very poor quality of life, would your answer change? And so our ability to say the way in which we're treating health and medically older people isn't working very well. Economically, it's not sustainable, but we can use AI to flip that around to say, what can we do? So instead of waiting for someone to cross over into being diabetic, are there things we can do to identify when they're pre-diabetic and either help them prevent that crossover or at least slow the progression, where instead of becoming diabetic next year, I can keep you from crossing over that threshold until 5 years later through a lot of things that are services in the home, proactive monitoring, predictive capabilities. We have a huge issue here. We have a huge opportunity to not only make the health system better, not just for older Americans, but for all Americans when it comes to health, but then redefining that to say, let's start spending more time talking about the health system's role in creating well-being.
Yeah, that's such a great point. And I know, Irma, you're a patient advocate among many other things. What's your perspective on that, and also the social determinants of health? I think we saw an article recently where two neighboring zip codes in Worcester, Massachusetts, had about a 20-year difference in lifespan. I mean, how do we tackle these kind of inequalities as well as others, race and income, et cetera?
That's exactly the question I wanted to ask next. And I'll just stop here for a second to say this intelligent aging insights, as well as the thing we'll ask you next about the zip code versus genetic code and social determinants of health, are just some of the topics you'll be covering in your upcoming book coming out in May, I believe. Hacking Healthcare was AI nicely pointed out in the title right there in hacking. How AI in the intelligence revolution will reboot the ailing system. So we're both very interested in that general topic, and specifically from a patient advocate perspective, and myself being an e-patient and the voice for empowerment of patients everywhere. I'm very interested in social determinants of health, as well as the other topics you cover in the book, which is the patient will see you now. So how are we gonna maybe flip the script a little bit on making empowered patients contribute to working with their physicians and within the system to improve that well-being that you mentioned, as well as the health economics. I love how you think that data will get its due, or maybe it's starting to get its due now. So could you tell our audience more about these topics?
Well, that's a lot to cover, Irma. First of all, I actually love
we have you for another 2 hours, right?
so I'm going to bullet point some things, starting with just tying off on the aging and that being a key challenge. So, quick shout out. As a matter of fact, here's a suggestion. So, AARP has an amazingly great program where they get this. They've actually launched like an incubation program for technology called Age Tech. Anyone interested in use of AI and technology to help older Americans, just go out, AARP Age Tech. They've got a great program where they're bringing in startups, early stage companies, helping them curate technology and solutions specifically to address the needs of the 50 plus crowd. But when you look at what they're doing, as they do it, it's really going to be beneficial for anyone at any stage of life saying, how do I live my best life when it comes to health and self-determination? So social determinants of health, you mentioned it. I always like to pop that quiz of, with all the data we have, which is a better predictor of health status today and going forward? Is it your genetic code, which everyone talks about, or to your point, is it your zip code? There's a lot of data that suggests where you live has as much, if not a greater influence on your health status than your genetic code. So the smart folks at McKinsey and company did a study where they estimate that when it comes to health status, if contributions to health status is viewed as a pie chart, 40% of your health status is really driven by social determinants. According to their work, about 20% of your health status is driven by your genetic code or those things you can't change. And interestingly, only about 15% of health status, according to this study, relates to the kind of clinical care you have access to, which is to say it's all important, but if we're focused on improving health status for individuals and populations, all of those social determinants and how we're handling those need to get pulled forward in the conversations, in the research, in the funding, if we're serious about improving health status. And if you want to go deeper on that, just go out. Another great resource is the Commonwealth Fund. They do this annual report on health conditions and health status of countries around the world. And for the last at least 5 years, they point out that America spends more money per citizen than any other country in the world. And yet, by all health measures, we are dead last. So it just starts raising that conversation of, well, why is that? And I think a big part of it is, if we're talking about health, we've got to raise the consciousness to go beyond talking about health reform being who has access to hospital services and much more on all these other variables. Where you live determines things like, are you in a food desert or are you near the Whole Foods? Are you in a place where you can go out and get fresh air and exercise? Or, I mean, there's so many variables, and I'm sure many of the people listening are very tuned into this, but these are the conversations, one, we need to be having when it comes to health in general. And then two, you bring underneath the ability to use the data and the AI to say, well, how do we actually, go from talking about these things to having real applications to define things like, all those variables to which if we can get our hands around and arms around, we can do better when it comes to improving health status.
Such an amazing topic. And just a couple more points that might be timely. There was a big retail show in New York City. And why is that important? Well, it may be that retailers are part of the solution as far as consumer health, and Microsoft has made some big moves and announcements and partnerships in the retail space, and you're actively involved in the consumerization of healthcare. What do you think? Are retailers, do they have a role to play in fixing or enhancing our healthcare system?
Yeah. Well, again, let's pull back, and all of us are the experiences we've had in the last 2 years with COVID. Think about the role retail pharmacists or pharmacies played when it comes to everything from where you would access, drugs, medications, where you got your vaccine. So yeah, I think retail health is a huge area. I would maintain that when it comes to convenience, actually improving that patient and consumer experience, they're going to play a large and growing role when it comes to how we interact with the health system. So today in America, there are about 2,000 retail health outlets that are built into things like CVS, Walgreens, Boots. yeah, Microsoft works with all of the big players. We recently made an announcement on a partnership with CVS and what they're trying to do to basically reimagine or re-engineer service delivery through retail outlets. So once again, let's just pull back and look at many of these have urgent care centers that are pop-in. They are a perfect place when it came to when all of a sudden we've got a vaccine, vaccinate an entire population. They stepped up. They were a great point for distribution. I saw a data point the other day on Walmart, which is making a big play in health. And one of their VPs pointed out that the majority of Americans today live within 10 miles of a Walmart. So whatever you think about Walmart and health, when you think about people in rural locations and the ability to access health services, I mean, those are the factors we need to think about and consider. And then you start adding to that, they can provide care, they can provide pharmacy services, including counseling and education. They're also a place where you can buy healthy food, all the supplies. And then increasingly, most of them have these things called reward programs. And I predict what you will be seeing is the reward programs of these big retail health companies are increasingly going to start having rewards that start nudging people towards proactive, healthy behavior. So they've got a lot of assets, they're well positioned, and they prove through the pandemic that they are a major force when it comes to conveniently getting a lot of things done.
Well, that's really exciting.
You mentioned convenience. It brings me to the next point I wanted to talk to you about, and that's health equity and health tequity, which perhaps a term that you coined. I haven't heard that before.
I was told I should trademark that, but I haven't. So if anyone's listening, please let me do it first.
Okay. So the question I wanted to mention first, you mentioned CVS and Walmart and how important these retailers have been and continue to be during the pandemic, and they increase access. They're right there in people's neighborhoods. But to tie it to tequity, I know firsthand because I volunteered for an organization that helped people book vaccines early in the year, last year, when they were very scarce and very hard to book. And even between CVS and Walmart has a much more accessible, they didn't have vaccine available early on, but now for even boosters and people to get a vaccine now, it's much easier to navigate. CVS website is actually not that easy to navigate for people who are not tech savvy, and they still required, at least in the past, they required a printed out or on the shown proof of your appointment on the mobile phone. And actually people don't have, not everybody has mobile phones. I was surprised to learn, even in Boston. So how do we promote equity, and how do we work with communities to increase that health equity from your perspective?
Well, let me see if I can bullet point that and not take too long. So first of all, I'd back up to say, as I think about the conversation, which is mainly me talking, which is not always good, let's recognize that when it comes to AI, everyone in health and medicine is early in the journey. And anyone who says they've got it figured out are either misinformed or something. Everyone, including Microsoft, is early in the use of AI to make healthcare better. So if we start with that as a basis, we're all trying. We're all, part of the reason I use the word hacking healthcare for my new book is, in my circles, that's a positive term. It's saying we're going to experiment. We're going to look at trying new things to innovate things we know don't work very well. So it starts with that. The second thing, and it's an issue for everyone, whether you're a data scientist or a consumer, a clinician, being early in the game, the decisions we're making today will determine whether AI is going to produce good for all citizens or only for some citizens. And that relates to everything from, as we look at machine learning and predictive capabilities, there are already data out there showing that the biases of the real world in healthcare are crossing over into the digital world through algorithms. We can stop that, which starts by awareness of that happening, use of tools when we're developing algorithms to stress test them to make sure that their predictive capabilities are good for all patients, not just Caucasians, not just a certain gender. Beyond that, and again, let's go back to the pandemic. Telehealth came to the forefront. It's been credited with basically saving healthcare, and it did. And the data is showing, it produced major benefits. But as we look closer and look in the rearview mirror, it produced major benefits. But the data is starting to suggest that telehealth produced more benefits if you were middle class and above, if you were a certain race, if you lived in a certain location, which brings us to we've got to have awareness and a dialogue around things like, and you said it, Irma, not everyone has access to good connectivity. Not everyone has access to smart devices. There are many people, back to social determinants of health, who did not grow up, gaming or being around this, and whether it's being economically disadvantaged or being a certain age, digital literacy is critical. Digital literacy today is as important as knowing how to read in past decades. So if we're going to pull forward things like telehealth as a viable option to do better for everyone, we have to be aware of and start addressing those issues of how do we make sure there is good connectivity? How do we make sure that for those who want, we can help them with things like digital literacy skills? And this is back to where groups like AARP are doing a phenomenal job of trying to champion those things. But it's incumbent upon all of us to recognize we have the ability to use AI to actually reduce the inequities. And if we don't pay attention to it, if we don't care, we're basically going to be transferring the biases and equities of the real world to the digital world. And I was on a panel for MLK Day earlier this week, and I think I raised a few eyebrows. But my challenge was, we've got to do this because otherwise, we have the potential danger of creating a digital version of the back of the bus for some people. And we don't have to do it. We can make it better for all. But it gets down to those are the issues, and those are the choices all of us need to be paying attention to.
Wow, evocative and thoughtful as always. That was quite a tour de force in a mere 35 minutes. Wow, very amazing, Tom. Thanks so much for chatting with us, and we may even see you in person.
I'm always happy to visit with you all. Thanks so much for all the work you do in promoting so many causes online. Really appreciate it.
Thanks so much, Tom. Likewise. I know we barely scratched the surface. Maybe we'll get to tour with you again.
That would be awesome. Maybe even at HIMSS. I heard rumors you may be attending to be determined. So thanks, everyone. Thanks for viewing.
For all of us is, there'll actually be face-to-face meetings as we go in the spring. We'll see. Maybe I'll see you in.
It's the ultimate question mark. We'll follow us all on Twitter and look forward to picking up the conversation there. Bye, everyone.
Evan, Irma, thank you.